Good afternoon, everyone, and welcome to another edition of Your Health Matters here on Kaieteur Radio. I'm your host, Rehanna Ramsay, and today we will be discussing rehabilitation services in Guyana. I have with me our guest is Miss Erica Verwayne, who is joining us via Zoom, and she will be telling us a little bit more about the topic. She's actually the manager of the disability for the Open Door Center for the Disability and Rehabilitation Unit under that center. Good afternoon, Ms. Verwayne. Are you hearing me?
Good afternoon. Yes, I am.
I believe it's your first time here with us on the radio, and I'd just like you to share a bit about what you do with our listeners, because most people have probably never heard you before.
Okay, no problem. Okay, as you would have said before, yes, my name is Erica Verwayne, and I am the acting manager at the Open Door Center for Persons with Disabilities.
Mm-hmm. And tell us a little bit more about what you do in terms of the work at the center.
Okay, at Open Door Center, we provide vocational skills training for persons with disabilities between ages 16 to 45, whereby they come for 2 years and they learn a skill, either information technology, garment craft, carpentry, or beauty care.
Okay. And so we're talking about rehabilitation services in Guyana, and I know you can speak basically for the Open Door Center. But can you say, in your estimation, why rehabilitation is important to our healthcare system? Rehabilitation services, that is.
Okay, rehabilitation is quite important because rehabilitation caters for persons who are not 100% capable and able of being, let's say, a person who would have been involved in some sort of sport injury or anything of such, and they can no longer perform or do things for themselves anymore. That's where rehabilitation comes in. They provide therapy for those persons.
Mm. And there are more types of services under the broad heading of rehabilitation. Can you just list some of the types of patients that rehab services cater for? And tell us specifically about those who are affected by things like stroke or even COVID-19 or amputated limbs.
Okay, rehabilitation caters for a wide array of impairments and disabilities affecting persons from either baby stage to elderly, such as hearing impairment, prosthesis, cerebral palsy, and persons who would have been affected by stroke, and also persons who are amputated.
Mm-hmm. And there are certain services, like I'm told that with amputee patients, you fit them with limbs and so on. But for persons with stroke, how does that play in? Like somebody who has now had a stroke on their left side or their right side, and they need rehab services. Tell us a little bit about that and what they have to go through in terms of getting back
Okay,
on their feet.
so for persons who would have acquired a stroke, they will be at the PALMS Rehabilitation Department on the
Mm-hmm.
dam,
Mm-hmm.
whereby they deal with persons with stroke. They help them to regain optimal functioning,
Mm-hmm.
and the patients usually come in based on the referral process by a doctor.
Mm-hmm. And they go through a period before, like let's say somebody has stroke and they're now trying to walk again. They have to go through a period before they're released back into society, basically, to go on their own. Or does this require like lifetime therapy?
It varies from person to person.
Hmm. And in terms of COVID-19, let's talk about that because people don't realize that there's something called long COVID when you're affected by the infection, and if it severely affects your organs, you have problems breathing. And I'm told that rehab services are provided to persons with COVID-19. Just touch on that a bit so that people would understand some of the things that, you know, they can benefit from.
Yes, well, with persons that are affected by COVID and so on, the long COVID, which rehab services actually provide, they would indeed help persons with breathing and so on because there are certain um, effects from persons who would have been
Yeah, lung
affected by
scarring,
COVID.
lung damage, and so on.
Yes, and we also have at the COVID hospital, we have staff there that currently works with persons that are affected by COVID.
Hmm. And they would get them up walking and, that like breathing exercises and so on. That would be some of the things that they would offer.
Correct, correct.
All right. In terms of, we're talking about rehab services and what Guyana has to offer, and you were attached to the Open Doors Center, so you can really speak about basically there. But you have some information as to what's out there as well, broadly. In terms of people's specific needs, do certain patients need rehabilitation more than some? In terms of, like, let's say somebody, um, I understand that there are different categories of patients, Ms. Farway.
Yes.
I understand there are different categories of patients. Do they need rehabilitation more than others?
It depends on the patient and their capacity because remember, sometimes one patient might be able to push for longer hours of therapy as compared to another person.
Mm-hmm. And in terms of, like we spoke about stroke and COVID-19, there's certain patients that would have to go through this for a lifetime, right? Tell us about some of those persons. What scenario would need constant rehabilitation for a longer period? Hello?
Well, yes, they are. But what they try to do at the different departments is that they try to show the patient or a relative of the patient what they can do at home to assist in that patient becoming more functioning
And mobile.
faster.
Mm-hmm. So basically, you take them up to a point, and if they need lifetime rehabilitation, it continues in their home. That's what you're saying?
Yes.
And does the rehab services that we have here available in Guyana, do the rehab people, the professionals visit the homes of these patients? Let's say, like, for instance, when we were in COVID-19, we don't get to, most of the places were closed and a lot of social distancing happening. How were you able to carry on reaching out to your patients and providing service to them?
Patients were still being seen at the various facilities, but the only thing was that the patient load would have decreased.
Mm-hmm.
The patients were still being seen.
Mm-hmm. And it has, since we are climbing out of the pandemic now, have you seen like a more intensified need or demand for your services?
Definitely, because within each of the departments on a monthly basis, when they have to produce the patient records and so on in terms of the amount of persons that they would have seen on a monthly basis, their numbers are definitely increasing.
Mm-hmm.
So there is more awareness, and due to more awareness, more patients are coming out and so on.
Mm-hmm. Would you say that your patient load has doubled or no?
It has indeed.
It has, it has. And when it comes to, I touched on amputee, but when it comes to the amputee patients, I'm told that a lot of them are the ones who would have suffered from diabetes and they would have lost probably their leg or so on. can you speak to how many you see on a probably a monthly basis? How many of those persons come into the Open Door Center, if that's something that you offer, though?
At the Open Center, no, we do not offer that. At the Autism and Prosthetic Workshop at the Trauma Rehab Center on Michael Street, they would see persons that are in need of orthotics or prosthesis.
Okay. As we go along, I want to get into certain things about physiotherapy and the difference between, because you said Open Door Centers doesn't focus on that. If you could just rehash for me some of the stuff that you would focus on, and just let's get into that. We'll just take a little short break, and then we'll come back and talk about what specifically the Open Door Center has to offer. Okay?
Okay.
Yes. Welcome back to Your Health Matters here on Kaieteur Radio. I'm your host, Rehanna Ramsay, and we're talking with Miss Erica Verwayne about rehabilitation services in Guyana. She's attached to the Open Door Center, which deals with rehabilitation and reaching out to patients with disabilities. So, Miss Verwayne, are you back?
Yes, I am.
She's here on Zoom, so just be a little patient with us when it goes and comes with our little connection here. Ms. Verwayne, we were talking before you left about rehab services and so on, and you were giving us some details as to what is available and so on. But in terms of your center specifically caters for persons with disabilities. Tell us about some of the services offered there, and then we'll go into some of the steps that you take when you're screening a patient and all of that.
Okay, so at the Open Door Center, which is located in Seafield, Sophia, the same compound as the Sophia Health Center, we provide vocational skills training to persons with disabilities between ages 16 to 45. Once you have the willingness to learn, we will say yes, come on board, and we will teach you a skill. And the skills that we offer are information technology, garment craft, carpentry, and beauty care. Each of our program is for 2 years, but if we realize that someone isn't performing like at least 60 to 75%, we would usually keep the person back for 1 year. The programs are free of cost.
And it's a 2-year program. And on an annual basis, can you say how many persons would tap into that course, or to what you have to offer there?
Okay. Because for each course we have a maximum of 12 persons per classroom, because our classrooms are small and we try to ensure that attention is given to everyone. Because remember, persons with disabilities, especially persons with intellectual disabilities, require more attention.
Mm-hmm. So, how many classrooms? 12?
4 classrooms.
Okay. And you have different courses for each classroom. And how do you
Correct.
screen? How do you decide who gets what to participate in what course?
Well, we have an application process.
Mm-hmm.
A parent or guardian usually comes, collect an application form, they fill it up, we give them a brochure of the different skills that we offer, and they will decide, well, which skill they think would best suit their child, and then we conduct an interview after such.
Mm-hmm. Oh, so we were talking about, besides the Open Doors Center, we were talking about broadly what's available in Guyana. And when it comes to persons who have to go through, and I mentioned this to you before, and you said, okay, you're not a physical therapist, but you would have some idea as to what they go through. In terms of the difference between the type of work that they have to put in, as opposed to somebody who is probably just giving a person rehab for a drug problem, are they the same? Do they work with the same type of intensity? Would you say it's the same type of intensity?
Well, for the physical therapist, their goal as a therapist for the patient is to regain optimal functioning, whereby they can come to some sort of semi-independence for themselves.
Mm-hmm.
And for a person who does rehabilitation for persons for drug-related persons, they would tend to like share support in terms of like counseling, helping persons with withdrawal symptoms, and those who might want to relapse and so on. It's two different. While both are rehab, it's two different technique and training and so on.
Mm-hmm. And so some would require more work than some in terms of what I'm trying to get at, because some are more challenging. I understand that with drug rehabilitation, you would have persons slipping back more often than with the physical rehabilitation. I don't know why, but I was hoping you could touch on that.
Yeah, because for persons who seek rehabilitation through the physical therapy departments,
Mm-hmm.
after their completion of their therapy and so on, they would regain their semi-independence and they will continue to live, the regular life.
Mm-hmm.
While for a person who might have drug-related issues, it's a little bit more difficult for them because when they go back out in society, the things that were there before, most of the time it's always there.
Yes.
You will see drum shops and all these things still there. So their relapse is very, very high.
Yes. And because the work of therapists in general is so intense, how do you grade? Do you have a grade system that you check to see your progress? Because some, not just therapists, but doctors do this as well. I've spoken to some of them, and for different things, they would check along to see your progression. Is it the same way with therapists?
Well, for the therapists on the rehabilitation services, well, they would do their assessment or evaluation of the patient every time they come to see their progress, to see like how much, or if there's a need for them to do a bit more work, or so on.
And in terms of the support system, outside of the therapist, how important is family support and, let's say, psychological support when persons are going through rehabilitation, a period of rehabilitation?
Family support is quite essential because, let's say, for instance, a person who would have had a stroke and they are coming to the palms for therapy, they would have to depend on that family member or relative to take them for therapy. Because then with persons with stroke and so on, they would have to use a taxi to get around.
Yes, I understand.
And they would need support from the family for that. And also, they would need like mentors, so to speak, because you're going around your normal life and then you have a stroke, your independence has gone.
Mm-hmm.
You have to depend on persons to do things for you.
Mm-hmm.
So family system and the persons within your home environment would need to be there to,
Mm-hmm.
reassure you that, everything is okay, you're going to get through this, and you're, they're going to give them all the necessary support that they can give them so that they wouldn't feel down.
So, what are some of the things? Let's say somebody has a stroke, or something happened to them, they lose their limbs. What are some of the things that we can say to them to encourage them along? Because I know it's not just affected their physical body; it has affected their mind, and as you said, that impact is psychologically can be very dampening. What would you, as a therapist, encourage, or what would you encourage persons to say to their loved ones to encourage them, um, you know, to help strengthen them during the period?
Give them all the reassurance that things are going to be okay.
Mm-hmm.
They are there for them. They are going to support them throughout their therapy. They're going to continue to support them throughout their scope in terms of if, if they regain their independence. Because
Mm.
remember, persons that would have acquired a stroke and they're in the home, they have to get assistance to like bathe them, feeding, dressing, and so on. So as the relatives do these things for the stroke person, you could just have one off chit chats with them, telling them everything is all right. Maybe bust a few jokes and so on to lighten up the atmosphere.
Mm-hmm. We talked about outside of the physical disability issues, we have some learning disabilities. And Guyanese, as Guyanese, this is not something that is widely discussed. Could you talk a little bit about and mention some that you would recognize that would come into your center and so on, and how we can address this on a broader, probably a broader scale, or if it's not being addressed, because I'm not sure what's out there. Tell us a little bit about some of the learning disabilities that you've recognized and how how you've been addressing it.
Okay, so at the center, yes, we do have persons with learning or intellectual disabilities, as we would usually call it. And one of the things that we do here is we have a teacher
First,
that
uh,
does.
could you first say what are those learning, like for instance dyslexia, I believe, or
Oh, this dyslexia.
yes, can you list some of them and then you'll tell us about the how you address those.
Well, those form of intellectual disabilities are usually diagnosed by either speech therapists or the diagnostic center. So um, I'm not a professional person that really can speak on such.
Okay.
That's usually done by diagnostic testing.
But in terms of what you see, what are the types of learning disability that will come into your center? Because you mentioned them, so just give me a little bit of what you have there, what you deal with.
Well, we do have persons here with dyslexia.
Mm-hmm. And dyslexia is Miss Varwit.
Yes, I'm here. Just excuse me.
Yeah. So just discuss why I wanted to break it down, because people would hear about something in passing, see it, but it would just go over their head. So I just wanted them to get a little sense of what you're dealing with on a daily basis, or whenever these persons come in, this is what you have to address. So if you can just break down a little bit of what you basically have to, the patients would come in with, and some of the work that you have to do to get them, to respond to learning in a more adequate way.
Okay, so some of the things that the instructor would usually pick out from persons with learning disability in terms of being dyslexic is they have problems with like reading and writing and spelling and so on. Because sometimes you will show them, well, this is how you spell this word or so on, but then they do it different. So it's a continuous something that you have to keep doing continuously.
And you can recognize this how? Because let's say somebody's listening to the program and they might not know their child is dyslexic or has dyslexia, and the child is not responding to the reading or the writing, but then you say something that would trigger, their thoughts along that line. How did you pick up that, okay, this person is probably dyslexic or has dyslexia?
Well, what our instructor would usually do, if she realizes that after like several or so tries that the child is not getting it, she would usually like go to the internet and type in certain information and see what will come up.
So she takes them to. Go ahead.
Sorry, go ahead.
I was asking if she takes them through like a screening process.
No, at the diagnostic center they do a screening process.
Okay, and so you can refer persons to the diagnostic center?
Yes.
Okay, so
they are actually under the Ministry of Education, the diagnostic center. They're actually under the Ministry of Education.
Okay, so if you have persons who come into the center and you recognize that they might be struggling with a learning disability, you refer them. So that's part of your mandate as well. You can refer persons.
Correct.
All right, just let's go to a little break. And when we come back, we'll just have a little bit more, because last week was Rehabilitation Week, and I know you were part of the activities, and you'll just give us a little bit more on what came from your center and some of the things we need to know about Rehabilitation Week, why it's important, why persons should give a little bit more care or a little bit more attention to people who need rehabilitation in Guyana. All right, we'll go to a break now.
Okay, no problem.
Meet Terence and Shabana. Both believe they've been exposed to COVID-19 and were advised by the Ministry of Health to quarantine themselves at home. It's a normal working day, and Terence grows tired of home quarantine guidelines. So he heads off to work using public transportation. Now all the passengers and his co-workers are in danger of contracting COVID-19 from Terence. After work, Terence heads straight to the gym for daily exercise. He shares the same exercise equipment with many others that day. Later on that evening too, Terence heads off to play several rounds of dominoes with some friends. By breaking the quarantine rules, Terence has endangered the lives of the passengers, his co-workers, members of his gym, and his friends with whom he played dominoes. By contrast, Shabana practices social distancing. She works from home every day, and in the evenings, she video chats with her family and friends to stay connected. Shabana is also obeying all the guidelines that the Ministry of Public Health says we follow when quarantined at home. Shabana has infected no one. Let's all do our part and practice physical and social distancing by avoiding unnecessary travels and staying home from large groups of people, including our families and friends. A message from the Ministry of Health in collaboration with PAHO WHO. For more information, visit our website at www.health.gov.gy or visit our Facebook, Instagram, or Twitter page.
Kaieteur Radio, keeping you informed.
Demerara and Essequibo 99.1 FM.
Burbies 99.5 FM. Kaieteur Radio.
Welcome back to Your Health Matters here on Kaieteur Radio. I'm your host, Rehanna Ramsay, and we're discussing rehabilitation in Guyana. With me, I have joining me via Zoom, Miss Erica Verwain, and she is the manager of the Rehabilitation and Disabilities Unit under the Open Door Center in Sophia. She was giving us a rundown of what the center has to offer. We touched on learning disabilities and how they do referrals once they recognize that your child or person may come in with that impairment. They would refer them to the relevant spaces where they can get help. Ms. Verwain, we're coming down to the end of our show, and you've given us quite a bit on what's offered, what's out there via the Open Door Center and even the Ptolemy Reed Center. But in your opinion, would you say that we're Guyanese, we're tapping in, our citizens are tapping into what is there for them? Because I mean, if you don't know, you wouldn't know that it's available, or you won't know that you need to visit this center or that center to get whatever services they offer. But in your opinion, just let me hear from you as a professional. Are we tapping into what is offered in terms of rehab services in Guyana?
Most definitely, persons are tapping into the services more because I'm guessing more information is being shared, and persons who would have been beneficiaries of the different services are sharing their experiences with their other family members or friends and so on, and they're coming to seek the services as well.
Mm-hmm. And in terms of your rehabilitation, last week was Rehab Week, and I understand that you would have played a part, given that the mandate of your center in spreading awareness. Tell us a little bit about last week's observance, some of the things you would have advocated for and are advocating for now.
Yes, so last week was Rehab Week, and Rehab Week usually a week of celebration for our staff, whereby they're saluted for their hard work over the years. Some of the things that we would have done for Rehab Week is we would have had an intensive school screening exercise that was done throughout the regions, because we also have rehab services available in all other regions other than Region 4. And they would have conducted intense school screening as those in Georgetown, whereby they would have targeted primary and secondary school children.
Wow. And in terms of your advocacy, what are some of the things as a person in this field, working with persons with disabilities, what are some of the things that you're advocating for, Ms. Verwain?
We are advocating for persons to access our services more. Although persons are accessing, we still think there is a need for more persons to have access to our services, especially children. Because when the school screening was conducted, it was realized that within the school system, we have a lot of children with impairments. And those impairments can be corrected once the parent or parents take their child to the necessary departments to seek the different therapy.
And these impairments are like, can you give specifics?
Persons like with speech impairment, whether you're autistic or so on.
So
because within each of the schools that were visited last week, that was one of the things that actually would have stood out. We have a lot of nursery school age children with speech impairments.
And the parents wouldn't know this unless they're screened. On average, how many schools, and how many children were screened last week?
Okay, last week it would have been over 20 schools, and the amount of children would have been like between like 500 to 1,000.
Wow. And
Just within the nursery school system, they have a lot of nursery schools and a lot of children within those nursery schools.
And this would be primarily the Open Door Center, or the Open Door Center in collaboration with other agencies?
No, this is a rehab services initiative.
Okay. And so your center was part of that?
No, this center would not have participated in such an activity. It would have only been for professional therapists, like speech therapists, occupational therapists,
Okay.
physiotherapists, and the audiology.
Okay, and because you were a professional in the field, you were part of it.
Correct.
All right. In terms of going forward, I know that we say that the pandemic is basically, some people, not us, because we're in health. Some people saying, "Oh, it's basically over," but we're still seeing cases. Are you continuing your lobby for persons to be vaccinated and immunized against COVID-19 amidst all that is going on?
Yes, we are. We're still encouraging persons to get their vaccine, and for those who would have taken both doses, we're advocating for them to get their booster as well.
And when somebody has whatever ailment or whatever impairment requiring rehabilitation, it is safe to be vaccinated. I just want you to touch on that, because people would say, "Oh, I'm already sick. I don't want to get the side effects or anything."
Yes, they can still get their vaccine. Persons who have stroke, persons who have other ailments, because even persons that are HIV positive can have the vaccine.
And it's important because they get more protection. That's right.
Correct.
So we basically come down to the end of what we had to talk about on air. I hope that people who tune in would have gotten a bit on why it's important to basically understand rehabilitation and what's out there in terms of the services, and understand that persons may not be physically impaired, but they can have learning and other disabilities that require the services, and you can get your children screened, because Ms. Verwin just spoke about having screened 500 children. The rehabilitation unit, not her unit specifically, but in collaboration with the broader unit, having gone to 20 schools and screened children, especially nursery children, and finding a lot of impairments that are undetected. So she's basically encouraging you to use their services and get your children screened, get persons screened if you recognize that your child is not responding to reading or writing the way he or she should. They may be dealing with a learning disability, and there are services out there that can help in that regard, get them diagnosed, get them the help they need. So as we come to the end of our discussion here, I have Ms. Verwin tell you about some of the services that are not just at the Open Door Center, but some of the other places you can go to get rehab services in Guyana. And I'll have her talk a little bit more on Open Door Center, because it's her center. That's where she works. She's the manager there. And then we'll close off. Go ahead, Ms. Verwin. Tell us a little bit more about what's out there in terms of persons getting rehabilitation, accessing rehabilitation services in Guyana, outside of Open Door Center.
Okay, so rehabilitation services is offered in all 10 administrative regions, and within some of the regions, there are sub-regions that offers same rehabilitation. Because for Region 1, we have Mabaruma, Maruka, Port Kaieteur. For Region 2, we have Study and Charity. For Region 3, there's the Reservoir Regional Hospital, Legon and Wakenham. For Region 4, we have the Palm Geriatric, we have the Tom Reed, we have the Georgian Public Hospital. Georgian Public Hospital, they have the audiology department, which does testing of the ear and so on. We have the speech therapy, occupational therapy, and physical therapy. We also have the Shesha Home in Mahaipa that does all three services, occupational therapy, speech therapy, and physical therapy. And we would have recently opened a department at the Supply Health Center, and they offer therapy there as well. For Region 5, there's the Myconi Hospital and Fort Belton Hospital. For Region 6, we have New Amsterdam, Skeldon, and Port Morant. For Region 7, there's Bartica and Camarang. For Region 8, there's Madia. Region 9, we have Lethem, Anai, and Aishalton. For Region 10, we have Wisma, Mackenzie, and Kokwani. So within all of those areas, persons can seek rehabilitation services.
And these are free of cost?
Free of cost. There's no cost attached for these services because it's government-run facilities, and the government will provide all the necessary tools and equipment and so on that the departments will need to carry out their job.
So basically there is no excuse for persons who need it and don't access it.
Yeah, that would have to be a personal responsibility on the patient's end.
And in terms of the Open Door Center, you spoke about that offering some different types of services where you train persons. Just because you talked about it earlier, but just for those who are probably now tuning in and they want to know how to get onto you and how somebody could benefit from your service, just tell them a bit about how they can reach out to the Open Door Center.
Okay, so if persons want to call in to us, they can get us on 219-2738, 219-2753, or they can come into our centers located in Seafield Sophia, the same compound with the health center.
And those persons will be able to access services that will allow them to be more profitable in society. That's where they get trained to do craft and other carpentry and some other stuff that you mentioned.
Yes, definitely. That's actually the aim and objective of
So if you know somebody who is practically has a disability or something, and they need this type of special care and attention in terms of learning something that will help them to gain some kind of revenue and so on, you can reach out to the Open Door Center that looks after that sort of, the Open Door Center that allows for persons to be trained in that regard. That brings us to the end of our discussion. Thank you, Ms. Verween. Thank you for joining us via Zoom. For those who logged in on Facebook, those who listened via radio, we're grateful to have you as our radio audience. We hope that you continue to take good care of yourselves. And until next time, do have a pleasant rest of the day.
Thank you very much, you too.
Bye-bye.